So today's lesson is about minimizing the pain from Botox, and at least we are going to talk about 25 tips. In the future, we might even some more. If you have any actually other tips that we didn't mention, please send us an email or comment. We'll add them as well, or at least we'll discuss them. So the group one is related to the patient comfort measures and to the product related pain reduction as well. The first one is preserved bacteriostatic saline. This serves two purposes. It keeps your injection actually better and more sterile and preserved. At the same time, it has benzyl alcohol, which is kind of an anesthetic, and patients usually report less pain when you mix the Botox. When I say Botox, I mean any of the brands. So keep that in mind. So in the United States, I am now in May 2026, and so far we have 6 brands in the United States, and we're expecting one more brand this year. The second is the topical numbing, the cream. You can apply it, and I would like here to say that different patients will have different experience with that, and even as in a clinic, depends what numbing medicine you use, and some of the carrier, the base, will get absorbed faster than others. Some say like 20-30 minutes. Honestly, if you have a really good numbing medicine, usually it get absorbed in 5-10 minutes. So make sure you get a really good numbing medicine. And ask the patient. Some people like these methods and the tips that were given. Some people they don't. Some people will never ever allow you to do that. So don't assume that every single patient will be treated the same. I usually know my patients over time and know what they like, don't like, and I always encourage them actually to let me know if there's anything I can do to make them more comfortable. The ice before injections, the same thing as the numbing medicine. I do use it in some few patients, and again, some of them they ask for it. Here, I would like to emphasize as well, make sure that you clean, of course. So I ask the patient to hold the area, for example, for the 11, they hold the ice over just before injection. I clean again, and then I make sure that the area is dry as well. The vibration distraction, I do use it sometimes if the patient especially asks for it. Make sure that it is not on the way. You have to be comfortable. You're more important than the distraction device. So if you're comfortable, the patient is comfortable. So make sure it's not on your way. Like any stress reduction, the breathing techniques is also important when we're injecting Botox, and it distracts the patient as well. So that's an extra help. You have to be careful. Number 6, to reduce anxiety with clear explanations. Here, honestly, some patients would like more explanation. Some like, no, just do it. So you have to be careful. Again, don't assume each patient is different. Know your patients and have a relation with them. I usually as well write a little notes about each patient on my medical records so that I know them, and then in the future I don't have to kind of guess or guess less what they like, they don't like, and that will help actually make things move nicer and simpler and smoother. Number 7, to keep the patient comfortable in the position. It helps you and the patient. If the patient is really slouching and the angles, whatever, is not really he's not comfortable, and also you're not comfortable. So I always tell my patients, the more I'm comfortable, the more they're comfortable. So I'll make sure both the patient and the injector are in comfortable position and height and angle that minimize the pain as well. Of course, if you use alcohol to clean the area, make sure that it is dry, because otherwise it's gonna stink. For that reason, I usually honestly don't use alcohol. I use Puricine or something else to clean the area before injection. Or if I do, I wait, and especially for filler or thread, and then I'll just actually clean with something stronger than alcohol. Anyways. Confidence and the gentle pressure after. The last thing you want that the patient sense that you're not confident in your movement and your injection technique and all that stuff. So you really have to be very confident. And then if you apply a nice gentle pressure after, it serves two purposes. First of all, it actually minimizes the bleeding because you're applying gentle pressure, and at the same time it distracts the nerve receptors, and then you apply pressure around the injection, so it activates more pathways, and that helps the patient. As a bonus, sometimes a stress ball, again, have stress balls or some other squishy stuff for the patients to squeeze on, and again, it is applicable to some patients but not all. So the second group is related mainly to the needle, syringe, injection techniques, and similar. When using a needle, I usually use a BD needle. That's me, 31 gauge, 0.5 cc. I've tried 30 gauge needle. I've tried 32. 30 is a little big and more painful. 32, you have to apply pressure, which defies the purpose of being less painful. So the sweet spot for me is 31 gauge needle. When you're aspirating, through the vial stopper, make sure you don't be very careful. Honestly, personally, I usually take the stopper out and I aspirate directly from the vial. And I'll explain in different lessons how to do that and not to lose any of the Botox as well. But through the crack, the opening, the side of the Botox vial, you could see where's the tip. So make sure that you do not touch the glass while you're aspirating, because that also will dull the needle. Changing the needle frequently, it is very important. Usually after the fourth injection is fine. After fourth injection, sometimes the patient starts feeling a little bit more pain, so you might opt to change needle every fourth injection or so. When you stretch the skin before injection is very important, because you minimize the receptor area where you're going to inject, and then the patient will feel less pain actually. And then entering the skin decisively is very important. Don't hesitate. Don't go like right and left and slow. Just do it. Nice, gentle, steady movement will help you and the patient. The shallowest effective depth is very important. For example, if you're doing the crossfeet or orbicularis oculi, the muscle there is very superficial. So if you go deeper, you're not doing anything else except you are increasing the pain and as well the chance of bruising, because you might encounter blood vessel if you go deeper. Well, you didn't even know you need to do that. We spoke a little bit about number 7, basically steady. Some people like slow injection. I don't like to use the word slow, because also very slow or slow injection might cause pain. So nice steady injection, not squirting very fast, because that also will cause pain. So that will cause also low pressure. This is also related to, remember, the gauge of the needle. So 31 will not create too much pressure as well when you're squirting the liquid out. Stabilize your injection hand. That will help you and help the patient. Be careful where you're putting your hands on the patient's face, though. Sometimes if I'm too much, like, in certain areas of the patient that I shouldn't be really leaning too much, or if I'm used that, then I'll warn the patient. So like, I'm sorry, I'm doing this, and I explain to them that I'm doing it to make them more comfortable. Then they appreciate it. They appreciate that you're trying to make them more comfortable, and that you apologize where you have your hand on their face. Avoid unnecessary direction, the same as related to the other items. Just know where you are, know the depth, know the angle. Just go in, put the medications, and come out steady, confident movements. Number 10, through a relaxed muscle. I'll talk about this a little bit more in another lesson, because that will affect as well the spread of the liquid. So when the muscle is relaxed, the patient is a little bit more comfortable, but at the same time, it will make the liquid spread more. So we'll talk again about this more in different lessons, but you have to be careful. If your purpose is to make the medication spread more, then it is fine. But if you are trying to make the medication stay where you're injecting it, so it might be actually better to make the patient contract that muscle. The correct syringe is very important. In the past, I used to do the 1 cc syringe, BD syringe. I found that to be a little bit too big, and then especially if you're gonna, you use it multiple times and change the needle, so you're gonna, waste more, and ergonomically is not as comfortable as the 0.5 cc. Some people use the 0.3 cc. I know that. It's okay as long as you choose the needle and you get comfortable with whatever you choose. Then it's okay. Be mindful of, anyway, we spoke about that, because it also affects the depth. So choose the right angle, go in, go out, as we said before. Of course, if we see a blood vessel, then we have to avoid it. And a lot of time, honestly, even if you don't see a blood vessel, because it is hidden under the skin, and you get close to, believe me, the patient actually, that's how you know there's a blood vessel there, because the pain in that area. So have to be careful. Either change the area immediately and apply a little pressure, because you don't want that area to have any bruise, or just change the direction sometimes and go out and then change the direction away from the blood vessel, especially if you see it. If the patient has unusual pain, also stop. We don't see the pain receptors, of course. Some areas will have more little nerve or pain receptor than others. The nerves have little branches all over the place, and at the same time, the skin has receptors. Some area will have more. So if that area is painful for the patient, just stop and move to a closed area, and still you can give the medication in that area and still cover the area that you want to cover. Choosing a different brand, I see it in my practice. Some brands will hurt more than others. There's no consistency. Sometimes I feel like Zeman, for example, hurt patients a little bit more. But I always remind the patient, education is very important in everything that we do. So if you tell the patient, look, it might sting a little bit more, but it'll be worth it because, I don't know, the patient responds to that medication better. You have a promotion that the patient's budget sensitive, and then you're giving it for a little less money, whatever it is, if there's a reason. And then if you educate and if you tell the patient what's going on, they'll also appreciate it and they'll be okay with it. And you tell them, look, it's going to be worth it in the long term. Again, although we're trying to make them comfortable for a few seconds, but the results are going to last for months. So you have to always work with the patient, which is more important to them. If you have any question about this lesson or any ideas, any comments, please let me know.